Status and future scope of hydrogels in wound healing, synthesis materials, and evaluation. The wound used for this presentation was any traumatic wound presenting with moderate drainage. The wound may have regular or irregular borders but may not exceed a diameter of 10 inches or a full thickness wound. The wound may or may not present with odor, infection, or any additional complications. Hydrogel dressings are specialized type of dressing that take up drainage from the wound without allowing the wound bed to dry out. There is not one specific type of wound for the hydrogels. Instead, they are appropriate for any wound with mild to moderate drainage. Hydrogel dressings are traditionally used to keep the wound bed moist while absorbing excess drainage. However, they have limited mechanical properties, meaning they lack successful innovative additions. In this research article, Zion et al. Investigated advanced modifications to the hydrogels. These include improved bandage strength, improved promotions of collagen synthesis through embedded medications, increased non-toxic cross-linking, and improved stability with changes in skin temperature. Previously, the medications on the hydrogels interacted poorly with the body. These medications would be rejected or attacked by the body and would delay the healing time of the wound. This study thus worked towards making these medications more bioavailable. The authors of the study also worked to reduce potential tissue damage by engineering the surface of the hydrogel to be recognized as almost as part of the body in hopes of decreased rejection by the body. Hydrogels have always been a viable treatment option to keep the wound beds moist while absorbing excess drainage. These modifications assessed in this research article demonstrate further improvements as there is a reduced chance of toxicity with cross-linking, as well as improved strength of new tissue and a faster immune response. Zion et al. Has expanded the scope of the hydrogel, now allowing the treatment for more complicated wounds. Complications may include infection, odor, and poor healing potential. Hydrogels are especially useful for wounds that require additional medications that may be impregnated into the dressing itself. They are also of the use in wounds with limited immune responses, such as the dressings may enhance these responses through exogenous medications. The researchers in the study were unable to tackle the issue of poor bandage adhesion, so this may be an area for further exploration and research. Based on the new advancements of hydrogels, I would recommend the use of these dressings for wounds with moderate drainage because of the improved delivery of medications into the wound bed, decreasing the chance for toxicity, as well as the ability to respond to normal body changes such as fluctuations in surface temperatures. I would recommend future research into improving the adhesion ability of the bandage.